All right, hello everybody. Thanks for being here. Welcome to the Department of Civil Services Employee Benefits Division's presentation for the Retired Public Employee Association annual meeting. My name is August Heinrich, and I'll go ahead and get started with our agenda. So we'll start by covering some of the recent benefit changes that were implemented on July 1st of this year. We'll address some recent updates to the Empire Plan. And lastly, we've included some brief information regarding facility charges. So first, we'll get started by addressing some of the July 1 benefit changes. These recent changes were implemented because CSEA, the state's largest employee union, negotiated a new contract with the state last year, and part of the contract included changes to the Empire Plan benefits. These benefit changes also apply to employees represented by the Unified Court System, Management Confidential employees, and other groups, including New York State retirees. All July 1 plan changes were detailed in a special Empire Plan report publication that was mailed to enrollees during the summer. This report includes a QR code that can be scanned to view a video about the recently implemented changes. And we've also included a web link on this slide, and the publication is available at NYSHIP online. One recently implemented change is the elimination of copay stacking for an office visit. Only one $25 copayment in a single visit to a network provider is charged. Includes visits to network-managed physical medicine providers. As an example of this change, an Empire Plan member takes their child to the pediatrician for a sick visit. While at the pediatrician's office, a rapid strep throat test is done. There is only one $25 copay for the office visit and the diagnostic test performed. Prior to July 1, these two services would have two separate $25 copayments. Next, as of July 1st, the telemedicine program is now a permanent benefit offering with no copayment required. This program is currently Live Health Online, offered by Empire Blue Cross. Live Health Online offers access to board-certified doctors, psychiatrists, psychologists, or licensed therapists on your smartphone, tablet, or personal computer at no cost. We have included a web link to access the service on this slide as well. And as a reminder, telehealth with a network provider are subject to the same copayment as in-person visits. As of July 1st, mastectomy bras obtained from a non-participating provider are no longer subject to deductible or coinsurance. This means that this is a paid-in-full benefit, regardless of whether the provider participates with the Empire Plan or not. On July 1st, the in-network out-of-pocket limits were lowered. As an example, the previous family coverage total maximum was $18,200. It has since been reduced to $8,000. This means that out-of-pocket costs for in-network services cannot exceed these new maximums. For example, an enrollee with individual coverage no longer pays more than $1,400 in co-payments for prescription drugs. Also, these new out-of-pocket values are printed on enrollee's benefit card, collected in the benefit cards that were did over the summer. The Empire Plan has developed a new Center of Excellence, or COE, for substance use disorder in partnership with the nationally recognized Hazelden Betty Ford Foundation. Treatment is paid in full, no out-of-pocket costs to enrollees using the Center of Excellence. Services include detox facilities and outpatient services, as well as supports to individuals and families, including vital support services and care coordination for transition back to the home community. Similar to other Empire COE programs, a travel, lodging, and meal allowance is included. It is always the enrollee's choice if they want to use a COE. This is voluntary. And finally, the Empire Plan must be the enrollee's primary coverage. The site of care program for infusion of infliximab, the brand Remicade, is now administered by Empire Blue Cross for Empire Plan primary enrollees. Remicade is a prescription drug used to treat conditions such as rheumatoid arthritis, ulcerative colitis, and Crohn's disease. Under the new program, Empire Blue Cross reviews the setting for the infusion clinically appropriate, works with the enrollee's doctor to transition patients to a non-hospital-based setting. These alternate non-hospital-based settings include a freestanding infusion site, a doctor's office, or the enrollee's home. Empire Blue Cross issued a letter to enrollees that includes additional information and will work with an enrollee's doctor to coordinate care. There are no co-payments for the infusion when an alternate setting is utilized. As of July 1st, acupuncture services received from an out-of-network provider to 20 visits per calendar year. However, there is no change in the benefit for acupuncture services received from a participating provider. Acupuncture received from a participating provider is not subject to a visit limit. Visits made prior to July 1st of this year do not count towards the new out-of-network maximum. As a reminder, out-of-network benefits are subject to an annual deductible and co-insurance obligations. Also starting July 1st, the Empire Plan implemented a visit limit for massage therapy services. Coverage is available for up to 20 massage therapy visits in a calendar year. Visits to a network-managed physical medicine provider, such as a physical therapist, generally will not count towards the 20 visit limit. The visit will only count towards the limit if the provider bills for a therapeutic massage. As a reminder, script is required from the enrollee's medical provider, which is not a change. And lastly, visits made prior to July 1st, 2023 do not count towards the new maximum. Another plan change is a new reimbursement method for non-network medical surgical claims and non-network mental health and substance use claims. The allowed amount used to determine payment of claims is now based on 275% of the Medicare rates in effect at the time of service. This means that the out-of-network providers are paid at rates equivalent to that Medicare pays. This could result in larger out-of-pocket costs for the enrollee, as out-of-network providers can balance bill enrollees for their costs. This change to out-of-network reimbursement does not impact rules related to surprise bills. Enrollees continue to be protected under law for care received out-of-network in emergency situations. This change solely impacts enrollees who choose and schedule appointments with out-of-network providers. The Special Empire Plan report issued in the summer contains an informative Q&A about this change. And as a reminder, resources are available for enrollees seeking a network provider. The Mental Health and Substance Use clinical referral line, along with the Empire Plan nurse line, are both available 24 hours a day, 7 days a week to assist enrollees. And enrollees should call the toll-free number found on the back of their Empire Plan benefit card. As I briefly mentioned before, the Department of Civil Service reissued Empire Plan benefit cards this summer due to the recent changes. These cards should have been received by now, and there were no changes to the enrollee ID numbers. There won't be a reissue in January because information such as the maximum in-network out-of-pocket limit will not change in 2024 for New York retirees. Now I'll take a few moments to address some additional recent updates to the Empire Plan. You may have heard of recent legal challenges to the Affordable Care Act. Should provisions of the Affordable Care Act related to preventive care ultimately be struck down, the Empire Plan will continue to provide preventive care services with no enrollee cost share required. New York State law requires that preventive care received from a network provider be covered in full. The FDA recently approved preventive care services for respiratory syncytial virus, or RSV, including vaccines for adults age 60 and older, and RSV monoclonal antibodies for children ages 0 to 24 months. As of August 30th, 2023, both of these services are preventive care. Services are covered at no cost to you when administered at an Empire Plan participating provider. COVID-19 vaccines and booster shots administered at an Empire Plan participating medical provider or vaccination network pharmacy are covered at no cost to you. The same goes for influenza or flu vaccines. And lastly, I'd like to take a moment to address facility charges under the Empire Plan Hospital Extension Clinic. Hospitals can charge facility fees for outpatient services performed by employed physicians who work in a hospital extension clinics. When a member sees a physician or receives services at a hospital extension clinic, they are being treated as a hospital-owned facility, even if the clinic is located miles away from the main hospital campus or care is being rendered in a member's physician's office. Hospital billing policies are not always apparent regarding hospital-owned extension clinics. Professional services and facility fees can be billed separately at a hospital-owned extension clinic, and in the past, members could be responsible for a facility fee charge. Effective for dates of service on or after February 1st, 2023, Empire Plan members are no longer responsible for paying facility fees. If facility charges are billed by the hospital extension clinic, the most members would be responsible for is a medical, surgical program, or professional services, co-payment, and a hospital program co-payment. And that concludes our content portion of the presentation. Questions are for you at this time.
If you have questions, you're welcome to step up to the mic.
This is on. Okay, if you have questions, please go to the mic in the center of the room.
Hi, I'm Bob McLaughlin with the Western New York chapter, formerly with the Department of Financial Services, that handled some of the rating for health care companies. Just a question, I know a few years ago there was a change in the tiers within the health plans where there formerly was an individual cost, there was a husband-wife or partnership cost of the insurance, health insurance, and there was the family coverage.
Before.
Can you hear me all right? Anyway, a few years ago, the partnership husband-wife tier was eliminated, and those individuals, including myself and my wife, were put into the family tier, which costs quite a bit more than the old husband-wife couple partnership tier, and it's been much costlier in the last few years. Is there any way that your organization could negotiate going back to the 3-tier? Because most of the retirees here are in either partnerships or husband-wife. They've kind of moved away from the family portion of healthcare, and I think it would be very beneficial for our retirees to have the benefit of the husband-wife partnership tier back in place.
So I'm not familiar with NYSHIP ever having a couples tier. In civil service law, it's designed as individual and family. But regardless of that, when NYSHIP has looked into including a couples tier, what effectively would happen if that were to be the case is that that cost has to shift somewhere. So what would happen is that that's just going to further increase the cost for family plans. It's really not saving money. It's just displacing that cost to a different population. So that's. And additionally, the structure of the tiers is established through collective bargaining, and so the the unions have not had an appetite to pursue a, two-person tier. So the plan hasn't, there hasn't been that need to implement the plan because it's not something that has been pursued by the unions. I think that there's a couple of reasons why, and that's the main thing, is that it's really just going to be a shift in the premium and increase the family rate. And additionally, it's not something that's been pursued by the unions. And once the unions were, that's August was talking about, when the unions a new benefit, it then gets administratively extended to the retirees. So because the unions haven't negotiated for it, that's why the plan as a whole does not have that third tier. Does that answer your question?
Yes, it does. But so you're saying there's no chance on that one?
I mean, I don't make all the decisions, so I'm not saying there's no chance. But when that has been explored in the past, it's usually not been considered feasible for a couple of different reasons that I talked about.
Okay, thank you.
No problem. Any other questions?
Anyone? No? Oh, yep, there's one coming up.
Yeah, Bill Worcester, Capital District Chapter. The question is, how does the retirees get to advocate for centers of excellences related to retirees, such as geriatric services and/or perhaps some of the other surgeries that as you get older you tend to lean towards, where you could have centers of excellence which would provide a lower cost for the plan if they would have those. So that's my question. How do we advocate for some kind of services for retirees?
That's a good question. It's not one that I've ever received before. I can certainly have a conversation with my director and find out, if that is manageable. I know there are, certainly centers of excellence for cancer services. That's a big. But in terms of services specifically for elder care, I'm not aware of. If that's been been a discussion, but I can certainly raise that point with my director.
Okay.
I'm just
I have a
making a
follow-up.
note for that.
I got a follow-up question. Do you know what percentage of NYSHIP are retirees?
What percentage of NYSHIP enrollment is retirees?
Yeah.
Off the top of my head,
It's
I
fine.
would say maybe about a
It's
third.
fine. I would predict at a certain time that it probably will be more than the active employees, which do get to sit down and negotiate the contract. So I don't have to know the number. It's fine. But I know the retirees are growing in number, and the actives are not growing at that same rate. Thank you.
Yeah, that's certain point taken.
Any other questions? Last chance, going once, going twice. Oh, sure, okay, you have one more coming.
Just a point of information to clarify things to the gentleman who raised the first question. We have talked with civil service on numerous occasions about the option of what is called +1, a spouse or a partner as opposed to being a family. And the way benefits are coming to us as retirees, whatever a majority of the enrollees in NYSHIP have as their plan, that's what we get. And CSEA is the biggest component. So workers, active workers, like the family plan because they have kids. And, you know, the +1 is not something that they generally negotiate for. And if that were to ever happen, and they had a +1 option, we would get it. But it doesn't exist for state enrollees. A lot of local governments have that when they negotiate. They have a +1 option, and then they have a family plan option. But it is, you are correct, that when you, and anyone who's in NYSHIP knows, if it's you and your spouse or partner, you are a family. You pay the same rate as if you had 5 kids on the plan. And that's the way it works. And in terms of the numbers, there's 240,000 retirees in NYSHIP. And 90% of the retirees in NYSHIP are in the Empire Plan.
Yes, another question coming.
I just have a small one, and I don't think he needs to answer it. The screens that he had up that had all the changes, are they written somewhere, or if we went to the recap, would we see those screens? Because it's hard to when you're taking all those notes.
We'll have it available for you.
You
Yeah.
will?
Yeah,
We'll get those, right?
so the changes that August discussed, the July changes, those were sent in a publication around the time that they were implemented. So I
Okay.
think maybe
I'll
around
look at my
May that went
bookcase,
out.
So I put those up on there.
Yeah,
Thank you.
I think the question was, is it possible for you to give us your set of slides? We can put them on our website, we can get them out to our members. Is it possible for you to do that?
Yeah, well, let me make sure it's okay for me to share the slides. It should be fine.
Okay.
But let me just double check. But yeah, we can certainly share the slides. But again, the information contained in the slides was mailed out in a publication to members in the spring. That publication is available on our website, and certainly if anybody contacted us, we could order them a physical copy as well.
Yeah, I think we all understand that, but it's a lot easier to look at bullet points on a slide than it is sometimes to try to understand what's printed in the booklet. So
Oh, certainly.
if we could...
Yeah, I can check make sure it's okay to share the slides. It shouldn't be an issue. I just want to double check.
That'll be great, thank you. One more question we
Yeah, of
have?
course.
Is the Empire Plan ever considering participating in the Silver Sneakers reimbursement, like the Capital District Physicians Health Plan does?
I'm not aware of any conversations within the plan about offering a Silver Sneakers type program. I can check and see what the latest is, but I'm not aware of any recent conversations on the topic.
Well, it's something good to look into. There's a lot of us participate, but we pay. Okay, that's it.
Okay.
Yeah.
Other questions? Yep, one more.
Jody Fox, I had a general question regarding the changes that you spoke about. You stated that a lot of these occur when the Empire Plan is primary. Does that mean that if Medicare is primary, these changes do not occur?
It depends on what in particular you're talking about. There are certain, because of the Medicare plan design, there are certain things that Medicare would take the lead on, and so there would be a different set of fits. So like one of the mentions like the prescription drug out-of-pocket costs, and there's an asterisk, does not apply to medical primary, and that's because people who are Med primary are on the SilverScript program. So there's a slightly different out-of-pocket cost associated with the Med primary enrollees. That's one that comes to mind. Is there any specific benefit or aspect of the benefits that you're curious about?
No, I'm basically asking, as a board member of RPEA, that this is information that our members would need to know and would be very important for the New York State Health Insurance Program to differentiate which programs are affected by your Medicare involvement and which are not. So these changes are more meaningful to us. Thank you.
Yeah, so with regard to those changes in the publication that we put out in the spring, you would find much more detailed information about, about specific elements of those changes, and if they don't apply to Medicare, what the Medicare alternative would be.
Thank you.
So, I apologize. I don't, off the top of my head, I wouldn't be able to rattle off all of the differences for Medicare, but definitely I suggest referring to that, the publication we put out in the spring, because that would offer a much more comprehensive summary.
I will look at that. Thank you very much.
Oh, you're very welcome.
I have a follow-up question to that.
Yes.
For things like vaccines, COVID, RSV, flu, if a member is Medicare primary, does Medicare cover those vaccines fully?
Yes.
I believe so. Yeah, I don't believe there's a difference when it comes to the COVID or the RSV vaccines.
Okay. Because the reason I raised the question is that I think we've seen the reports that I believe CVS in particular pulled the vaccines because people coming in were complaining that their insurance would not cover the vaccines. But for those of us who are Medicare primary, we would be covered, correct?
Yeah, why don't I'll take that back and I will follow up with Charisse just to make sure, but I believe so. I believe it would be covered in full, but I can definitely confirm, I think.
Okay, thank you.
You're welcome.
Other questions? Last chance, going once, going twice. Okay, thank you very much for your presentation, and we appreciate it.